Skin cancer can take on a variety of different colors, shapes, sizes, and forms. The most common one that comes to mind is melanoma. If you are concerned about one of your moles, is to utilize the ABCDE principle. When looking at that, A stands for asymmetry. So are both sides of the mole the same? Or maybe there's some discrepancy there. B stands for border. Are all borders of the mole nice and smooth and regular? Or perhaps one corner or one edge of the border is mottled or disfigured or something like that, right? That's sometimes a bit of a warning sign. C stands for color. So generally a benign mole is a nice smooth brown homogeneous color. If you start to notice things like blacks and pinks and even grays and blues, that can be a warning sign. D is diameter. So most melanomas we pick up are greater than 6 millimeters. If you have quite a large mole or you notice that a mole is enlarging, it's probably a good idea to get it checked. And then finally, E is for evolution. If you have a mole, maybe it's a new mole, maybe it's a mole that you've had for a while but it's starting to change, again in color, shape, maybe it's bleeding, maybe it's hurting. These are all really, really good ideas to get them checked. We also have non-pigmented types of skin cancer, and these tend to present as what we would call pink lesions. And these can encompass the other two main types of skin cancer we see, and they would be basal cell and squamous cell skin cancer. And these types of skin cancers generally occur on chronically sun-exposed areas. So generally the face, the head, the neck. They'll often occur as pink or flesh-colored little bumps or nodules. Sometimes they can come across as flat scaly patches or open sores that are just not healing. So the bottom line is, if you have a new lesion or a lesion that's just not going away or it's not healing over the space of weeks or months, it's a good idea to call into us and we'll check it out for you.